Distinguished panel, thank you for being here and allowing us to have this most beneficial hearing. Appreciate that. Gentlemen, we've been talking a lot in this subcommittee and the Homeland Security Subcommittee about the threat posed by synthetic opioids recently. During a hearing with CPB, where they recounted a recent seizure of carfentanil, my distinguished colleague, Dr. Harris, caught my attention after doing some quick math and noting that the seizure alone was capable of killing over 1 billion people. Obviously, we've been focused on the opioid issue for the danger it presents to public health, but I've quickly realized that synthetic opioids could be utilized as a chemical weapon. Indeed, it is believed that Russians deployed synthetic opioids as a riot control agent in the 2002 Moscow theater hostage crisis, which saw heavy civilian casualties. Is there a reason to fear, for Congress to fear, that organizations seeking to do us harm could be looking at these substances as possible chemical weapons? And if so, do you all have any recommendations on confronting this challenge?
Thank you, sir. I think I'll take the first swipe at your question. And I think the answer is to your question, yes, there is a concern. Number two is there's more detail that could be provided in a classified setting that I'm happy to provide. But the third thing is that the Department of Homeland Security has issued a material threat determination for fentanyl products. So it has identified, if you will, it as a material threat to our national security. That was signed out by Secretary Nielsen about 2 weeks ago. And our expectation with BARDA is that we'll be researching. We've done already some market surveys to see what is available out there already in the pipeline. We see this as a great opportunity to get a twofer, if you will, to not only look for the Homeland Security benefit of this to protect our potentially our first responders and others, but also find things or products that could be useful in the opioid crisis that we're experiencing here domestically. So we're in the midst of that. We'll be working closely with Dr. Fauci and his colleagues at NIH, with our SAMHSA colleagues as well, and obviously CDC to figure out what would be the best kind of products to do that. But we're early in that evolution.
Thank you. Gentlemen?
The opioid crisis is huge without this other potential threat, and I think the work that we're doing to combat that crisis that exists without the terrorist threat is going to help us be more effective in responding to a terrorist threat. So I think that I agree with Dr. Kadlec, it's a twofer. I think the work that we're doing day to day is going to make us better able to respond should an attack occur.
Thank you. Appreciate that. A follow-up question, Dr. Kadlec and Dr. Redd. In your testimonies, you both note that the work that the Department of Health and Human Services is doing to prepare for various public health hazards, including radiological releases or attacks. I'm sure you're aware the Department of Energy and the National Nuclear Security Administration, and NSA, also have important resources devoted to the same missions. For example, the Radiation Emergency Assistance Center training site, REACS, is located in my district. REACS is prepared to provide emergency medical assistance in the event of radiological or nuclear incidents, and also provides educational opportunities to students and professionals in the areas of radiation emergency medicine and radiological or nuclear incident medical management. Could you describe how assets from your department would work with experts from the Department of Energy in the event of a radiological or nuclear emergency, and how you ensure that the roles are not duplicative and the responsibilities are clear?
Thank you for your question. I'll take, again, first take on this question. And the first thing is our National Disaster Medical System would be the primary entity within HHS, at least in my organization, that would have the benefit of the expertise that it resides with REACS and the other programs in DOE. We believe that this provides an excellent opportunity to build a regional medical kind of disaster response system where we could use the assets, particularly the educational assets that are created by your institutes, to basically promote education and awareness within the healthcare community around the country. We are working to create a model that would be very similar to the Ebola model that was created, where we identified some centers of excellence around the country to promote not only best practices, but also to propagate information and training and also consultation should there be an emergency. So I think there's great opportunities to do that. I know Director Lisa Gordon-Haggerty from NSSA, and I served on Oak Ridge's scientific board, so I'm very familiar with the capabilities that reside out there, and they're ones that we will utilize going forward. Thank you, sir.
Thank you.
Radiation and nuclear get put together. I think they actually are quite separate in terms of the kind of response that would have to be mounted. An exposure either through food contamination or from a radiation dispersal device would be an event that would expose people to radiation, but not to a nuclear detonation, and that would have a lot of laboratory components to it. It would be a public health response, largely with, of course, with law enforcement elements. Nuclear detonation, I am in total agreement with what's been said. This would be a huge infrastructure destroying event. FEMA and DOD would be in the lead. We would be supporting all of that. We've spent a lot of time thinking about what our role would be and how we would interface with the rest of the federal government response. We have laboratory capabilities. We have communication abilities and basically how to explain to people what radiation exposure is. We have clinical expertise, and in the aftermath of the event, we would be establishing registries to follow people who've been exposed.
Thank you. Mr. Chairman, I yield back.
Thank you very much. Mr. Buchanan.
Sure. Thank you.